And Peter, I'll call us to order at 6:05. So agenda, let me pull that up. We have to make an amendment, unfortunately. Our warning was off by a bit. And let me pull that up. Share my screen. Okay, so Forrest wrote me and noted a few date changes and just some, I guess, wording placements that needed to go. Here we have annual school meeting, it should be. And then down here we have 21, it says 22. And I believe we just strike pursuant to the provisions of Act 162. And we add per school district vote on December 18th, 2021. So I think I just need to entertain a motion to amend as drafted here.
I will so move. This is Dan.
Moved by Dan. Second.
Yep.
Second by Jude. And any discussion on the changes?
Looks good.
Okay, then all those in favor say aye.
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 Great. Now I will try
So
and
do
stop.
you need me to resend it again for new signatures once you fix that?
That's a good question. I think you might need to send it for signatures, but the auditors don't need it for signatures. They don't care about the signatures, they told us. So yeah, I think we'll sign it again just for Forrest to get to, and if everybody could sign it as soon as it comes in, that'd be great. I don't know what's happening to my Zoom, but I can't get back to my screen.
Doug, while you're doing that, I should point out that Forrest has said today that he has not received any petitions for people running for the open seat on the board. So if anybody knows anybody who's considering, time to give them a nudge, let them know that there's still a few more days, but not very many.
Doug, you're muted.
Thanks, Dan. This is Jeremy. Just to let you know, someone had not turned in their paperwork due to quarantine, and I also will use that as an excuse for me not having my paperwork in. So while everyone should run who wants to run, there should be 2 people's paperwork in by tomorrow, if I'm correct.
Great, thanks, Jeremy. Thank you.
Doug, you're still muted.
Sorry. Thanks, Jeremy, for that. What I started with. And then I don't see any members of the public on the call. So we'll, I guess, skip that section. And no members of the faculty either. And so I think we're rolling right into superintendent's report. So Bill, take it away.
I'm sending you all an email that I'm going to reference in my brief report. So just want to let you guys know that I'm sending that. Just want to keep you informed that I sent out a letter to all the principals today. Wayne, like all other principals, will have the ability to send it out through his own channels. So he either is sending it today or he's going to send it tomorrow, just to update all the families on the transition to the new guidance from the state of Vermont, which basically changes, the transition changes schools from testing depots to distribution depots. And the state of Vermont received 400,000 tests today. And those are going to be distributed to schools over the next 5 days. We are making sure that we do not do this until we actually have the tests on hand. So we are communicating to families that we will begin this either next Thursday or next Friday. The timing kind of works out well for us because on Monday and Tuesday, we have professional development and report card work. So students are not in class on Monday and Tuesday. More than likely, we're going to receive these tests on Monday or Tuesday, but I just wanted to make sure that we weren't communicating to families and disappointing them, which I have seen in other SUs, and so I'm trying to learn from that. But basically what that means is that Sarah is going to have on hand multiple hundreds of rapid antigen tests, and she will be distributing them between a partnership between Wayne and Sarah. When there is a case, they will distribute them so that families can be able to test over multiple days and then decide to come in when they are negative. This is a broad transition for the state of Vermont as we go from living in a pandemic to preparing for an endemic. And so I saw in Wayne's communication to the families how thoughtful Marlboro is being in being responsive to the community, going above and beyond the guidance, being very specific about mitigation measures. We also have ordered and received today 10,000 N95 masks, of which will be distributed today and tomorrow. So that we have a 60-day supply for anybody who wants to wear an N95 mask and only wear it for a day and discard it. So we want to make sure that people feel safe. We want to make sure that all schools have supplies on hand. The masks are a general size, so it's really going to be for about age 9 and up. They don't make a specific small N95, or at least we haven't been able to find that. So we are recommending exactly what Wayne recommended in his letter to families. I believe it was on the 18th, of the kinds of masks that you can do. You can always double mask. You can have the surgical mask underneath the cloth mask. So for Marlboro, we'll be able to handle all adults and probably half your population through N95 masks that will be distributed. And again, that will be under the guidance of Sarah and Wayne. That's kind of, and then I will update weekly if necessary, if things change. But we are doing everything we can to keep the community safe and to keep schools open. So that's kind of my general thing about COVID. In general, I wanted to congratulate Wayne. He was accepted into the Center for Creative Leadership Development Program, which is an 18-month program that is run by an unbelievable organization out of North Carolina. Wayne and I and Doug have all taken courses from the Center for Creative Leadership in Beyond Bias, in having difficult conversations. Wayne is going to dive into an 18-month program that is specific for principals in leadership, communication, reflection. He's also doing it with 2 other colleagues in the WCSU, the principal of Newbrook and the principal of Dover also were accepted. So it's a really cool program. I'm very jealous. Superintendents are the bottom feeders when we apply for these. Only the principals get to go. One day, we're already at cohort 12 in the state of Vermont. So one day, maybe I will get to attend. I apply, but I always get dropped to the bottom because the wait list is so long. And then I just wanted to share just a little anecdote of some work that we did as a leadership team on Wednesday. This is the kind of the critical time in student learning where we get a lot of testing results, assessment results on how students are learning specific skills. And so it's a time to reflect and think about how we're doing instruction at school. And so on Wednesday, all the principals in the WCSU shared out how they're going to respond when they receive this data. And Wayne was the second person to go. The first person was sick, and so I had to step in and explain what they were doing. And then Wayne shared what he was doing, and nobody wanted to go after Wayne because he was so thorough, so thoughtful, and so integrated with the regular business of how Marlboro operates that it wasn't abnormal, that they would look at data, that they would look at results, that they would look at student learning, that they would tailor classroom interventions to what students needed. It was a highlight for me because, as you all know, we've gone through some transitions here in the last 18 months. And to see that level of respect from Wayne's peers was certainly very gratifying for me. I know Wayne's very humble. He will not tell you that. That's why I am telling you that. And then I just really want to appreciate how Wayne has gone over and above the COVID response. I think the letter he sent out this week, being very specific about how Marlboro is going to go above and beyond, really is a response to what is going on in the community. And it's kind of our mantra in the WCSU of freedom and unity. We kind of have a base level of unity, and then we have freedom flowing throughout. So that is my report. I've always sent you my written report as well, but I just wanted to highlight a couple of those things.
Thank you, Bill. Does anybody have any questions for Bill? And I think I just want to be the first to say thanks, Wayne, for all that work and for all those accolades that you're not sharing with us, that Bill has to share on your behalf. Jude, go ahead.
Great job, Bill. Can you hear me? You guys hear me okay? Okay, great job, Bill. Thank you. That was really good to hear. And, you know, I know you have been supporting Wayne for the last, whatever it is, 18 months or something like that, past 18 months. And so, you know, it's been a really challenging period. And then you add the COVID on top of everything. And I feel like you've been a really supportive person for Wayne. I think you guys got a really good relationship. I think it was so nice to hear you say just how fluid the exchange was. I forget what that was where you were with, oh, I know what it was. It was the negotiations, I think, or something. Anyways, where you were like, wow, there was none of the tension or distance, silo that I think we felt like the teachers felt with the superintendent role. And so that was like a very clear thing we wanted to address. And so I just feel like these measurable things all along the way are really doing a super job. So
Thank you, Jude.
props
I
on
appreciate
that. Also, I wanted to say that Bonafide, now who knows, there's just like, well, forget it. That's not on the government's buy list, that company. But Bonafide does have a small KN95 mask, and
Bonafide.
BONAFIDE,
Okay.
and these
Okay.
are certified, and they have one adult size. So there's not like small adult and large adult, it's one, but then they have a real small. And I think
Cool.
that actually could be for that under 9 set. So
Great. No, that's awesome. I appreciate that very much.
Thanks, Jude. Any other questions for Bill before we move on? Okay, I don't see any hands raised. So now we have COVID surge and protocols. We separated this out. It's really the focus, I guess I should merge principals report and COVID. So Wayne, I guess, is going to give us a little update on things in the school and the numbers, and then we can talk about it. And I have a dog that's pulling on me, sorry.
Well, luckily this time my dog is sleeping. Thanks, Bill. What Bill is referring to regarding the letter that I sent out to families at the beginning of the week was, and this was a response to really thinking about how last week went. And it was really challenging. Ever since we got back from the winter break, we all know that we've seen this huge spike in COVID cases. And so we really looked at our protocols and did some research. Luckily, there's a lot of articles right now this past weekend that was giving you all the best advice on masks and ways to help reduce the spread of COVID in areas. And so we did our research. We came back and so we added, just so everybody knows who didn't get it, is that one of the things that we purchased from the beginning is we purchased Wi-Fi enabled CO2 monitors for every single space in the school. So we know exactly what the CO2 is. And the interesting part was that we noticed a couple of weeks ago when it got really cold that our CO2 readings are spiking. So we were looking at it. We want to keep it around 800. And they were looking at 1100, 1200. And so we were able to open some windows. We called the HVAC folks. They came out and said, well, it's so cold that if we open up the flap any further, it's gonna freeze your coil. So you're getting as much fresh air as you possibly can. So at that point, we decided that we need to take these next steps. So in order to keep it at 800 parts per million, we are keeping just a window open in each class, just a little bit. And that makes a huge difference, especially when you're getting crosswinds throughout the school. So you open a couple windows here and there and that, you do it in your house, you do it in the building, and you start creating some airflow. So that's what we did. And that really helps. The other thing that we did is that we were really opening windows during lunch. We're getting some airflow because that's the time that we have the highest probability of spreading COVID, because kids have to eat, they have to sit down to eat, they're closer to each other. It's not like going outside's an option, especially with tomorrow being cold. It is what it is. So we're really opening up the windows during that time. So that was the first thing we did, and those CO2 monitors are really paying off right now. Again, we're just consistently hand washing, hand sanitizing, back and forth. It really is. It's just a part of the daily routine that we've had, and we're continually doing that. And then we updated our face masks, and so that now we are all using either surgical face masks, N95, KN94. We've now moved away from cloth masks because the research shows that even though you have a triple ply mask that feels like it's sturdy and it's got some good protection, it's still not as effective as the other masks, those surgical masks, those disposable masks. So we reached out to Greg at the WCSU, who's the facilities manager. He had some in stock, and we got some surgical masks in kid size. We also got some, I believe it's KN95 masks today for adults, but they come in so small that they work well for kids. And then we are also getting another shipment additionally of other masks for the adults as well too. So right now, as of yesterday, everybody is wearing either a surgical mask alone or a surgical mask and a cloth mask on top of it as well too. The cloth masks really help pull it in so that we are getting as much of a good fit as possible, so we don't have those little side bulges and things like that. Kids have been great. They understand where we are in this moment in time, and we've been able to do that too. And so we felt like we could really take these measures. We could do it quickly. We had masks available, and we were able to also send out a couple of resources on the best places to get masks, because now there's the challenge of trying to get true authentic masks and not counterfeit masks. So we've had to vet our masks as well too. One of those little challenges out there. So that's what we did. We sent that out, and I feel like we're just in a much better place than what we were. And this really came from a discussion that we had last Friday after school, where I pulled all the staff together and said, we've got to do something. Like, let's throw some stuff out there. I know there's not a lot we can control, But we've been very lucky to have very few teachers affected by COVID. And we want to keep it that way because we want kids in front of teachers. And we want kids being able to do that. And quite frankly, if we had 2 or 3 teachers out, I don't know, I'm not sure what we would do because of the lack of subs, the time in which staff are out. And I can attest to some of the challenges with catching COVID and really trying to work for a good week afterwards. If you end up with the symptoms that I have, you are mentally incapable of being able to be in front of people. So that's what we did. Any questions on the letter, thoughts around that? And I just have a couple more things after this, but I just wanted to see if you had any questions about that.
I'm not seeing any hands raised, Wayne.
I just want to say, great letter, Wayne. Thanks for doing that. So thank you.
Yeah. Well, the one thing we did do is that this is something that's going above and beyond. It wasn't a bullet, but it was in the letter too, is that when we're outside, we are now having students wear cloth masks. We had a choice, either A, no masks outside, and we have to socially distance the students and really police that. Policing is the correct word. That's how we feel, and it's not a good feeling. Or wear masks to make sure that when kids come close because they're playing or they're kicking the ball or whatever they're doing, that there's just that more protection. And the reason why we went with cloth masks instead of the other masks is that we found with students that if you go outside really cold, the condensation builds up so quickly that the masks that are made out of paper and such just disintegrate. And so we decided that we would just stick with the cloth masks. So now we have this mask system in the schools that when you are not wearing your surgical mask or KN mask, that it goes in your bag, and you can switch your masks out. We thought about the bag for a lot of different reasons. One of them being that we just don't want somebody taking their mask off and putting it on the table. We want to help reduce spread, especially right now. So, and this is in effect until February break, and we'll reassess after that. A couple other things. Today was the most students that we've had out. We've had 30 students out of 101 out today. It ranged from COVID related to mental health, and everything in between. So we did have 30 students, but we have been for the past couple of weeks, ranging between mid-teens to mid-20s, but today was the highest day. We've had for the last 2 weeks, we've had 16 students who've contracted COVID, and they have ranged from preschool to 8th grade. So every single class has had at least one case in their class that has done that. On Wednesday, I was late to a leadership team meeting because we had 37 students who did test to stay. And so I helped out Sarah, and actually many of us were down there helping out Sarah, just having kids up, come up and test. The other thing probably too is that one of my sons is the hardest to test. So I figured I would be there to help Sarah in that situation. And last but not least, we started testing at home today. We found out this afternoon that there was a case in the 5-6 classroom. We pulled all the tests together. We made our call. We called all the families, and all of those students went home with the proper tests that they needed in order to do the testing over this break, so that on Wednesday, everyone, if they test negative and have no symptoms, will be here on Wednesday. And we pulled that together. And actually, let me take that back. Let me strike through and say Sarah and Gail really pulled this together in about an hour, and made it happen. And so, because we said we have 2 tests left, 2 test kits left. That's all we have left. So we just made it with the supplies that we have. And as Bill already said, we have more supplies coming. So we feel very confident that we can move forward with that. So that's what I really have for COVID updates currently right now.
So
I see
Wayne-
Jeremy, then Dan.
Oh, okay, go for it, Jeremy. Yeah.
Dan, why don't you go first and I'll go right after because I have 2 things.
Mine is simple. I thought it was a 2-hour delay tomorrow, but the test to come back to school doesn't start till next week. Is that correct?
It starts tomorrow. There's really under the new guidance, if you're vaccinated and you've had close contact with somebody who has COVID, that you have to remain symptom-free, and you have to have a test on the 4th day and the 5th day, an antigen test on the 4th and 5th day that both have to be negative. If you're unvaccinated, you need to test every single day with an antigen test, be symptom-free, 5 days, be symptom-free and have a negative test. So we have students that will be doing tests tonight. And if they are negative and they are symptom-free, which I sure hope they are, they will be coming in at 10 o'clock tomorrow.
So Wayne, first of all, I wanted to just say thanks for all this stuff. I'm so glad that my kids go to this school, just above and beyond. The superintendent shaking his head in proud disbelief of all of the above and beyond. It's just such a joy to be doing this work and following your leadership. I was also wondering, do you need volunteers for the testing in the mornings at the school, or anything else, early morning garbage removal, anything that would help that you could use volunteers for?
I appreciate that, Jeremy. Testing, I think right now we are test to home. We are a test to homes school unless something changes. So that's really great. And Sarah's communication to families and back and forth is, I think, is really good. In regards to helping out at the school, I have thought about that. And but to be honest, I don't want anybody in this building right now because of the number of kids that are testing, and then trying to keep track of who was in, who was not in, who may have been a close contact, who comes potentially in and then calls me 3 days later that says that they were positive. I think at this point, I'm just really trying to seal up the building as much as we can. So, but however, I do appreciate that. And once these numbers come down, I do want to try to do that, because we have a couple staffs that are pretty stretched thin at this point.
So my second, thank you so much. My other comment is, I think that it's important for us to talk about the choice to stay in person versus to go remote as a board, both to support and also to understand your decisions. A few weeks ago, people were speaking assumptively everywhere about the inevitability of going remote. I just want us to be partially responsible for that if we are deciding to stay in person with these new protocols. And I just want to mention a couple points of why I think this is important. The first is that COVID-19 remains the #1 cause of death in Vermont. And that cause of death is among some of the most vulnerable people. While, of course, we should rightly be concerned about our students first, we do also have a responsibility as a public institution and as a community to try as best we can to not contribute to the suffering, unnecessary suffering and death of Marlboro residents and community residents. The unvaccinated, no matter what reason they're unvaccinated, and when it comes to unvaccinated children, obviously they don't have the choice, but there is a public kind of just a move towards blaming the unvaccinated for their own vulnerabilities. And that is not something that we do not need to do that. The resort towns just to our west and north, I think, especially in Dover, where I work, I mean, people need to make their money, and the attitudes about blaming are just, there's a lot of blaming going on. I'm, of course, a supporter of vaccination, but what I hear from otherwise compassionate and loving people about the unvaccinated being their own fault, I just think obviously no one on this call or anyone I know in this community would make that argument intentionally, but I want to make sure that we are thinking about the unvaccinated people in our community, especially those who didn't make the choice. Of course, this affects the immune compromised, and there are multiple local Southern Vermont petitions, informal on Facebook, and otherwise people trying to draw attention to their immune compromised statuses, rendering them basically prisoners in their own house, as economics are now seeming to weigh higher than the value of their lives, as one person put it. People with comorbidities, including obesity and other invisible disabilities, are also among the immune compromised. And seniors, regardless of their vaccination status, above, and I don't remember the exact age, but I believe it's something like 75 and above, regardless of vaccination status, are still in that vulnerable population of people that are dying. And then finally, I really appreciate all the extra protocols, as I mentioned. But I mean, having a child that struggles to keep his mask on, and kids, they're struggling with it, and I appreciate that teachers are probably doing everything that they can. But you just show up at the basketball and it's just ridiculous. I mean, they might as well not be wearing their masks, and I don't blame them. I don't know if I could run down that court once with a mask on, let alone a 2.5-hour practice. So these are the concerns I would have if I were in order to responsibly be a part of this decision, or if I were you. And I'm just wondering if you could respond just in general to why going remote is not a live option right now. And just finally, I think we've said before, it's not spreading in the schools. And I just simply would say we don't know that. And if anything, we can assume that it is spreading through the schools. And so I'm just wondering if you could respond to those things, some of them.
Thanks, Jeremy. Looks like Bill had his hand up. Wayne, do you want to let Bill go first, or do you want to talk?
Yeah, so I would just say globally, if the Marlboro School Board directs the Marlboro School to go remote, you are putting yourself at risk for having those days not count and having to run school up until June 30th. So it's just a real reality. Possibly canceling April break. Because you are statutorily required to have 175 school student days. The process is, if the Marlboro School Board decides that you would like to go remote, what I do is I fill out a form and a waiver, and I make the argument about why it was done. The Secretary of Education has been very generous in waiving days that are in response to realities, not in prevention of realities. So that's just something to consider, that as the board thinks about these things, if you go remote for 10 or 15 student days as a prevention measure, not as an outbreak response, that there is that risk. So I wanted to place that out there, because my responsibility would be to apply for a waiver, and then basically you're going to have April break, and you're going to have June 14th through June 30th that are your possible days to be made up. I've never been in a situation where you haven't had 175 days. I don't know if they would require you to go to school after July 1st. So just as a general measure, I just wanted to give context to that. Secondly, as you pointed out, Jeremy, Marlboro is going way above and beyond what any school district in the WCSU and any school district in my cohort of superintendents in Windham and Windsor County is implementing. So you're already going way above and beyond mitigation measures to create a supportive and safe environment. So that's just another context thing for this discussion. So I just wanted to give you that broad stroke, but ultimately it is the Marlboro School District Board that would be making a formal vote, decision, and direction to myself and to the principal of the operation of the school. So just wanted to give that context so that Wayne can provide the detail.
Great, thanks so much, Bill. I appreciate that.
Wayne, care to respond? Thanks, Bill.
Yeah, this has been on my mind quite a bit. It's one of those things like what is safer, what is better, and really looking at all the various pieces. So just to start out, we are ready to go remote. We have our first assignment. We've talked about the platforms that we would use, the ways in which we would go about moving forward to do remote learning. We had that discussion, I believe, a couple of weeks ago. We really hashed out the pieces. So we feel like we can do that when we need to. And just on another thing, Jeremy, you really brought up some great points. I think one of the things is that judgment. The New York Times really wrote a great article about a month ago that really pointed out who is unvaccinated. And it's very much not who we think it is. And it was a great article that used really good data and really broke down who isn't vaccinated. And I think that narrative is currently being twisted. So we really have to work together as a community. We have to place no judgment. This is a pandemic. Nobody's been through this. So we need to give folks the space and the energy and the time to be able to go through this at their pace and the way they want to. I truly believe that. And we talk about this a lot at the school. I think one of the things that we've been talking about as teachers and just in the schools, like, what is our goal right now? What is the goal of school? And for us, again, I think our biggest goal, especially for rural schools, is that kids can see each other. And when they see each other, they talk to each other. They have adults that are not their parents that they can talk to in a different way. They can run around with kids. They can have a hard day. And what I mean by hard is they came in, they ran around, they did some academics. Their brains were flexed, their arms were flexed. They go home, they feel like they did some work. That social emotional piece, I think, is really crucial to holding the community together and to having kids together. We know many of our kids, if we went home and we followed the precautions that we had before, would be isolated at one of the most challenging times of the year. That being said, there are no precautions out there. There are no precautions. There's thank goodness for folks in Brattleboro and other areas to push forward mask mandates and so on and so forth. So it's not safer outside of here. It's not that we are not allowing folks to not come in our state, or if we leave our state, we have to quarantine. I mean, thinking back to a year ago and the supports that we had to keep folks safe collectively as a state worked very well. We were leading the country, and those are all gone. So we are sending students home to an environment that's not as safe as it was before because there's no precautions there. So that was the other thing. The other thing is that, we do have more students vaccinated than not. I think that's helpful. That's something that's changed in just the last 2 months. 2 months ago, we did not have students under 13 vaccinated. Now we have more students than not vaccinated. I think that's a piece too. I want to say, and I said in my letter, that there's a good chance that it's spreading in school. Omicron, if it can see you 50 miles away, it's probably going to jump on you. That's the challenge with Omicron. And that's why we needed to take these safer measures and move forward. And I think these measures, I think, will help. And my hope is that some of these measures will be taken out to the community, and not only in our community, but far as well. So those, so I think the combination of all that, and honestly, we still feel like we can do it. I mean, I think the idea of like, we need to go remote because we need this, our students need this, our teachers need this, but none of us are feeling like that. None of us each day are feeling like that. We don't see smiling faces, but we do see crinks around the eyes, and we know that they're happening. And I think we can't meet that goal right now. We have a crisis in this country, and the crisis is that we have younger children that are having mental health challenges. And I think we don't, as a school, I still have a very low behavior challenge. Very low, extremely low. And I think that points to what we're doing and what we're doing well. And it also is pointing to that kids are getting that social emotional supports right now. So that's what I balance. I balance the health, the social and emotional piece. I do not think going remote would make anybody safer. may make it a little bit safer, but that social and emotional piece, we are making kids immensely safer by having them come into school compared to staying at home. And then, and the last piece is that we would be putting families in a quite the bind that would then lead to cohorts coming together. And then those cohorts, we found quickly from the last time is that essentially all of them overlap in some sort of capacity, so that we would essentially be in the same exact situation outside of here if we were to go remote. So those are all the balances that I face. And every day, quite frankly, I think of, should we go remote? And then I have to remind myself of all these positive things that we are doing. So hopefully that answers your question. And then, I'm happy to hear what you think about that as well, too.
Yeah,
so-
so Jeremy, I'll follow up, but then we're gonna move on, okay?
Actually, I have a motion to make before we move on if the principal's report is over, but let me know when it's over.
I don't think it's over. Let's just pause that and see if there's any other questions for Wayne on the memorandum that he sent out in COVID, and then we'll come back. Okay, Jeremy? Dan, Jude, no. Selena, I can't see you.
I don't have
No.
questions. I just really appreciate how thoughtful and thorough that was, Wayne, and I agree with you.
Okay, Jeremy's got a motion.
Yeah, so just in quick response, I hope that this is really like a collaboration. And I think that this is I hope that this is, a dialectic where we need to have different perspectives on something that we're not familiar with. And so I think it's really important for the board to also consider, you talked about the New York Times article, which I did see. I can't recall all the things about it. I think it came out at the beginning of my COVID, which was also not a cakewalk. But it's 40,000 Vermonters. And disproportionately rural, disproportionately poor, disproportionately in other ways socially marginalized. And we are projected to be 2 weeks out from the peak of the Omicron. So to add just that, hold that along with all of I'm so glad that you're responsible first and foremost to the mental health and the social well-being of our kids. I'm so glad that that's where you come down. But I would like to make a motion so that the board make a vote on this, even if it's a very quick discussion and quick vote. And so I would like to motion that we suspend in-person school for the next 2 weeks, at which point we would reassess. So that would be this coming week, following the 2 teacher in-services day, and the week following. And I would also accept a friendly amendment for a different duration of time. But the point is, I'll start with the next 2 weeks. So I motion that we suspend in-person school through the next 2 weeks.
Okay, motion is on the table. Do I hear a second? We need a second. I'm not hearing a second for discussion or voting. Okay. Sorry, Jeremy.
No, I really appreciate Wayne. I appreciate everyone. I think it's important that school board, that motion is out there. And I'm so happy to be a part of the plan that you've laid out, Wayne. Thanks.
I appreciate it too, Jeremy.
Okay. We do have other business beyond the principal's report. Wayne, unless you have other things you would like to share before we close that section.
Yeah, I got a couple good things.
Okay.
Mobile classroom coming next week. Woo woo. And we actually got tables and chairs, and they didn't take 4 months. They're actually here at the building right now. So I think those are great. Those are really great things to have. And then we are finishing up our benchmark window, and teachers are really invested. They're talking to me every day about it, and we're really excited about using this data to come together to just think about how we can meet the needs of our students for the remainder of the year. We are in January, but May comes really quick with all the breaks. and thrown a couple of snow days here and there. So we want to make sure that we are doing the best that we can during these challenging times. So that's all I have. And Jude, you did have your hand up, but that's all I have tonight.
I missed that, Jude. I'm sorry. Didn't see your hand.
That's okay. So I guess, thank you, Wayne. That was great. And I guess I would just say in response to what Jeremy lifted is that I just don't, I really appreciate so much of what you raised, and the spirit in which you raise it, I think is really healthy. I do not think that, I mean, for me to actually take this up, I would need more kind of a basis for how impacting the children, the teachers, the families through the board's action in this way would actually have an impact, a measurable impact on the case rate or the death rate among the students or Marlboro. And I don't hear that. And so, yeah, I really can't support what you're saying. I don't support closing the school. And I think that we do really, I don't know that we can ever totally quantify the risk or the impact of the mental health challenges, not just for the kids, but for the teachers as well, and the administrators and the school nurses and everybody involved. I just don't know that we can quantify that risk and that impact, but I think we're wrestling with it. And I think we really, that's a thing that I try to very much balance. And I know that you care about that a lot. And so anyway, I just do really, I really agree with what Wayne said, so I feel very happy about that. I'm not afraid of the discussion. We can talk about the value of masks or not, and how a lot of people don't wear masks, and they're not evil either. But I don't support closing the school.
Well,
So just
technically,
real
guys,
quick, I would-
stop. There was no second to the motion. I'm going to pause discussion. I'm sorry, guys. We can't be here all
Oh,
night.
you
Bill
waited
and
to
Wayne
pause
are
to
really
come out.
tired. Bill and Wayne are really tired people. I don't want to keep them here all night as we debate. So can we move on to other business?
I
sorry.
would like to respond to what was said, just to say that in the future as a board, there is, I would encourage people to second motions in order to go to discussion rather than to have just like feelings being shared, like where there's no consequence, like where there's no vote or no real discussion. So just in the future, one way that boards can operate is that you can second something in order to go to a meaningful discussion. So I would love to talk to you about that, Jude. Like, that's really cool. But we might as well just talk about it out of the meeting, because it's not a board discussion now, because no one honored it with seconding it in order to have a discussion or to go on record for voting. So.
Dan, you have your hand raised.
Yeah, Jeremy, I just want to respond to that. Say, I'm famous for seconding motions that I don't necessarily agree with, but I felt like you made such a great case. Wayne made such a great case before the motion was made, that I did not feel like it was productive to bring it back up. So in general, I will be the person who seconds the motion just so that we can have a good discussion. But I really feel that we have had that. So that's where I stand.
Sorry, I was muted. Yeah, Dan, you are famous for that, and I applaud that all the time. I, as you know, as chair, can't second anything. So, okay. But I do want to be respectful of Wayne and Bill's time tonight. I really want to hold that. So if there was a second, we would obviously be having a discussion, but it didn't feel like it was going to go there. So other business. Wayne's got nothing else to share. Is there any questions for Wayne before we move on? We just have minutes and pay order to approve. And I think Selena has the numbers for the pay order, and also a migraine, unfortunately. Are you still out there, Selena?
Yeah, hold on. I'm just pulling up the number. Hold on a second.
You want me to-
I'd like to make a motion to approve pay order dated January 20th in the amount of $381,771.76.
Can I famously second that motion?
Say the number one more time.
$381,771.76.
Thank you.
And Dan seconded. And were there any anomalies or odd things in that, Jeremy and Selena? No?
No, it was really straightforward.
Okay. All those in favor say aye.
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 Everybody said it and raised your hand.
Aye.
So next is minutes. On the WCSU site, there were a lot of drafts I sent everybody. We're hopefully going to approve those in one foul swoop. If I can hear a motion to do those as drafted, there are, I think, 4 budget meetings, essentially. There was the regular meeting in December and the 2 budget meetings on each end of those and 1 in November. No
I
motion?
make a motion to approve the minutes as drafted.
Do you have those dates, Peter?
I reckon I do. Would you like them now?
No, you just have them for the minutes, right?
I believe I have the whole list there somewhere.
Okay.
Whatever's not been approved.
Unapproved minutes for
Bring that
11/18, 12/8, 12/16, and 1/12. Okay, do I hear a second?
I'll second it.
Dan seconds it, famously seconds. All those in favor, or I should say first discussion, any changes or amendments? Okay, all those in favor say aye.
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 Jeremy, I got your hand. Okay, yes, aye, gotcha. All right, that is all we have for this evening. Does anybody have anything else they'd like to bring up for other business? Dan's got his hand up.
Oh, I was voting aye. Sorry about that.
Oh,
I'll
that's
take it
okay.
Now, how do I do that? Unlower hand. Oh, no, it went back up. This could go on forever. Thanks for hanging in there with me, folks.
No problem.
I would like to make a motion to adjourn.
Okay, motion to adjourn by Dan. Is there a second?
So moved.
Moved by Selena. All right. Thanks, everybody, for a good meeting.